Okay, the second one is the workflow and the structure in our departments. So I'm going to talk about the role of every staff involved in our department in this lecture. Starting from the patient. So if a patient is referred to our department to undergo any of our studies, first of all he has to go to the reception area. And the reception, the medical secretary, they will receive the request, and they will check the ID. They will check the information is fully written, and then they will send the request to the physician. And this is an example of a request. It can be used for normal nuclear medicine scans or for the PET-CT scans. So the physician has to check for if the patient is really in need of doing this study before approving it, and then it will be sent back to the reception. So the medical secretary, they will assist the nuclear medicine specialist with the correct name and stuff inside in our computerized systems. So they will enter the patient name and register them. The nuclear medicine specialist will give the proper preparation for the patient. So if the patient needs to stop any medication prior to the study, and give the proper appointments. Okay, we are in need of medical secretaries in our departments, and these medical secretaries they should be well funded with the English language. They know how to use the computer, because our appointments are computer based, and they should know most medical terms. And of course, the medical secretaries are very important because they take a lot of the administrative work in our departments. Okay, so I'm going to talk about a brief description of the role of the nuclear medicine, of the nurses in our departments. So on the day of the exam, the nurse has to ask the patient for the name and to make sure that the patient is the same as the request in front of her, and then she has to escort the patient to the injection room. This is an example of an injection room. So during the injection room, the nurse has to take the weight and height of the patient. This is important because we will not prepare any radioactive material without knowing these information, because we prepare the activity depending on the international standards, so we don't want to give extra dose to the patient. And then they have to fix a fresh IV line. Afterwards, the file will go to the hot lab. The hot lab is the place where the lab specialist prepared the radioactive material. As you can see, this is a shield. This is the shield. So and everything is shielded also. The syringe, the vial, and the surrounding. Everything has a lead shield. So they prepare the dose according to the weight and height, as I said earlier. Afterwards, the physician has to inject the patient. It can be under the camera or in the injection room, and the nurse will assess the physician in preparing him for the injection. So in the gamma camera, also the nurse has a role there in preparing the patient. And after preparing the patient, the nuclear medicine specialist will explain the procedure to the patient to ease him, to make him comfort, and then we'll acquire the study. Of course, the study will take, depending the timing, depending on the study itself. After acquiring the images, the nuclear medicine specialist has to process the images using high-tech computerized equipment, and then after that they they make a printout of the images. This is an example of a bone scan. On the right side, this is what we call a blood flow, meaning the patient was injected underneath the camera, and then we took immediate images within 5 minutes. This is a whole body scan. This is taken 2 to 3 hours after the injection. After that, the nuclear medicine physician has to review and report the case, also using the computer. And the secretaries are also helpful here in helping the physician typing the reports if they don't have the packs. Of course, we have the newest archiving system in our departments, so it is helpful to give the patient the report, the image, and a CD, so it will help him to go if he has to go elsewhere outside of Kuwait. I gave you an example of a patient doing our studies by having the radio tracer administered through the IV line. But also you can have other studies in administering the radio tracer in a different way. For example, this is a radioactive iodine is ingested. This is for the thyroid uptake. As I showed you earlier, the device is only to see how much uptake. So it's a radioactive tracer known as the iodine 131. It's a capsule. This is another example. It can be inhaled, and this is for the lung ventilation study. This is for the stress study, myocardial perfusion scans. They can do the stress through, by the treadmill or by pharmacological stress. It has to be supervised by a cardiologist. These are the types of scans we have in nuclear medicine. So I'm going to start with the static. Static meaning it's not moving. So we take a still image. The purpose of this is only to see the size and shape of the organ or the gland. The other type is dynamic. Dynamic is a moving image, but still it is a series of static images taken simultaneously. This is an example of a dynamic study. This is the renal scan, the kidneys. You can see the radioactive material is going from the kidney to the bladder, so we can see if there's an obstruction or dilatation of the pelvic. Tomography, this is also another type of scans. It is slicing the organ, electronically of course. We take from different angles and then we slice them. This is an example of the cardiac image. You can see on the short axis, horizontal and long axis slices. This is the PET image, the way it's imaging in a basic way I'm going to describe. It's like a ring, the device itself. So it's the patient, of course, is the one who's emitting the radiation. So the detectors are detecting the emitted radiation through a process called annihilation, and then the computer will do the reconstruction afterwards. Any questions?